welcome to my channel. Today we are going to discuss something different. That is, today we are going to discuss anatomy, not just biomechanics, but of course anatomy also. We are going to simplify it and do it in an interesting manner. I know that many of you are interested to study neuroanatomy in a simple manner, but for the time being we'll start with the lower limb. So let us move on to the lower limb. So in lower limb, today we are going to learn a concept, a portion known as the front of thigh. So when I tell you the term thigh region, what comes into your mind? The thigh means it is a region between the hip joint and up to the knee joint. So thigh is a region from the hip joint up to the knee joint. Okay, and when you discuss about the thigh, we are going to discuss about the front of the thigh. That is your thigh region. This anterior part, that is the front of the thigh, is the one that we are going to discuss. So understand, thigh includes hip to the knee joint, and front of the thigh is the thing that we are going to discuss. So when I tell you the front of the thigh, what comes into your mind? Just touch your thigh region and look. What is the first structure that you are going to feel? Not the cloth that you are wearing, but the first anatomical structure. The first thing that covers here is your skin. Absolutely right. The first thing is the skin. Immediately below the skin, what you have? You have the superficial fascia. I hope you remember what is fascia. Fascia is like a balloon. It covers the whole body. So immediately below it you have the superficial fascia. Okay, and then just below that you have the deep fascia. Just below that you have the deep fascia. Then you have the muscles. Then you have the muscles, and finally you have the bone. Which is the bone in the anterior of the thigh or in the thigh region? That is none other than the femur. So this is how we discuss the anterior of the thigh. The first structure that you have is the skin, then the superficial fascia, and then the deep fascia, then the muscles, and then the bone. So this superficial fascia contains lot of nerves and blood vessels and lymphatics. That nerves and lymphatics are known as cutaneous nerves and etc. So cutaneous, it contains cutaneous nerves, cutaneous blood vessels or arteries or superficial arteries. It contains cutaneous or superficial veins, and finally it contains lymphatics, lymph nodes. Better you say it as lymph nodes. So the superficial fascia contains cutaneous nerves, cutaneous or superficial arteries, and cutaneous or superficial veins and lymph nodes. Here you have to study the cutaneous nerves, the names of those nerves. Few nerves you have to study. The first thing is the, you can call it ilioinguinal nerve. Ilioinguinal nerve. So the first thing is ilioinguinal nerve. The second one is genitofemoral nerve. Genitofemoral nerve. Genitofemoral nerve. Okay, genitofemoral nerve. Third one, lateral cutaneous nerve of thigh. Okay. The fourth one, medial cutaneous nerve of thigh. Medial cutaneous nerve of thigh. And the last one, intermediate cutaneous nerve of thigh. Intermediate cutaneous nerve of thigh. See, these are the few nerves that you have to study in the superficial fascia. Once again, let us see that. It is simple. You can memorize it in an easy manner. I will show you. So this is the thigh region, this is the hip, and this is the knee joint. Okay, and here you have the lateral cutaneous nerve. Here it is passing. This is the lateral side. This is the medial side. So laterally a nerve is passing. That is known as lateral cutaneous nerve. Okay. Here this is the ilioinguinal region, and here you have a nerve known as ilioinguinal nerve. Inguinal nerve. Here you have the genitofemoral nerve. Genitofemoral nerve. Genitofemoral nerve. Better you say that femoral branch of genitofemoral nerve. Okay, and here you have the lateral cutaneous nerve. Then in between that you have the intermediate cutaneous, and here you have the medial cutaneous nerve. Medial cutaneous nerve of thigh. See, once again I will explain to you. The cutaneous nerves are the laterally located lateral cutaneous nerve of the thigh, medially located ilioinguinal nerve, just medial to, just lateral to that or just adjacent to that, the genitofemoral nerve, and then lateral cutaneous nerve just below, just adjacent to that, intermediate cutaneous nerve, then medial cutaneous nerve. One more easy manner to memorize is that cutaneous nerves can be three. Okay, lateral cutaneous nerve, medial cutaneous nerve, intermediate. So three. Then you only have to study ilioinguinal nerve and genitofemoral nerve. It is easy. Okay, and that is general introduction. In general introduction, I have told you again, there is skin, there is superficial fascia, there is deep fascia. Deep fascia is also known as fascia lata. Fascia lata. And then there is the muscles, then there is the bone. In that superficial fascia contains various cutaneous nerves and blood vessels, right? The cutaneous nerves includes three cutaneous nerves, mainly lateral, medial and intermediate. Then ilioinguinal nerve, then genitofemoral nerve. These are the things that you have to memorize, remember in the front of the thigh. That's just general introduction. Now we are going to study the most important thing in the thigh region, front of the thigh. One of the most important thing, that is the femoral triangle. Femoral triangle. Many of you have heard about the Bermuda Triangle, right? This is not that. This is not something related to that. This is the femoral triangle. So you can call femoral triangle as a triangular depression in, so this is triangle, so triangular depression. Where is it located? Front of the thigh. Triangular depression in front of thigh. I always say you have to be specific. Where in the front of thigh? In upper 1/3. In upper 1/3. So that is the definition. Femoral triangle is a triangular depression. Where is it located? We are studying front of the thigh. So in the front of the thigh. In upper 1/3. Or it is a triangular depression present in the upper 1/3 of the thigh. That is known as the femoral triangle. Now it is a triangle, right? It is a triangle. Okay. It will have an apex. It will have a base. It will have two sides, medial and lateral side. Lateral side. It will have a medial side, right? So let us see. Let us draw a diagram and study that. Okay. Let me rub this one. Yes. Here you have. I am drawing again the thigh region. Here you have the ASIS, anterior superior iliac spine. Here you have the pubic tubercle. Okay. Pubic tubercle. And there is a ligament running like this. This is known as the inguinal ligament. Inguinal ligament. Inguinal ligament. Then you have a large muscle in the body running like this. That muscle is known as the sartorius muscle. Yes, sartorius muscle. Very good. Now you have a muscle in this region. That muscle is known as the adductor longus muscle. That muscle is known as the adductor longus muscle. Now tell me, what is its base? The base is the inguinal ligament. Inguinal ligament. This one is its base. This is its base. Okay. This is the lateral side, this is the medial side. So this is the lateral border. Lateral side is made up of sartorius muscle. Lateral side is made up of sartorius muscle. What is its medial side made up of? Here, what is this muscle? This is the adductor longus muscle. So this is the adductor longus muscle. So we studied its borders, and okay, the base is made up of inguinal ligament. The lateral side is made up of sartorius muscle. The medial side is made up of adductor longus muscle. Now apex. What do you feel? Is the apex, is the triangle upward, located upwards or downward? This is an inverted triangle. So apex is downwards. Apex is downwards, and it is meeting point of medial and lateral border. Medial and lateral border. Correct? See, here is the medial border, here is the medial border, and here is the lateral border coming down. Meeting. This is known as the apex. So that is all about the femoral triangle in general. Femoral triangle is a triangle, and it has, since it is a triangle, it has an apex, it has a base, it has lateral side and medial side. The base is formed by the inguinal ligament, don't forget that. The medial side is formed by the adductor longus muscle, the lateral side is formed by the sartorius muscle, and apex is formed by the meeting point of medial and lateral border. I will tell you, don't memorize this, don't by heart it, just draw the diagram. Once you draw the diagram, you draw the diagram very well, and you just imagine what is its base, this thing, and you will get the answer. Inguinal ligament. You think what is its lateral border, you think what is its medial border. Now, can I be a little more specific, like we discussed about sartorius. The sartorius muscle has a medial side and a lateral side. So better I can say lateral side is made up of medial side of sartorius. See, right now, this is the medial side of sartorius, this is its lateral side. So the lateral border is made up of medial side of sartorius. And adductor longus muscle. See, this is the adductor longus muscle. Which side? The medial side. This is the medial side. So the medial side of adductor longus muscle. Medial side of adductor longus muscle. Okay, that's it. If you want to be specific, you can be specific. Otherwise, no problem. Just write sartorius and adductor longus muscle. Okay. That is general introduction about the femoral triangle. And now you have to learn something more in the femoral triangle. Now you have to learn something more. What should learn? Since it is a triangle, we already discussed it has an apex, we already discussed it has a base, we already discussed it has a lateral side and medial side. Medial side. See, this is the triangle. Okay, this is the triangle. This part of the triangle can be known as its roof of the triangle. Okay. See, just imagine this is how the triangle is located. So my right hand, this upper part is known as the roof of the triangle, and this part can be known as the floor of the triangle. So you need to identify the structures that are seen in the roof of the triangle. Okay, a roof. The first structure would be, let us write here, roof. The first structure would be, what is that? What is the first structure seen in the thigh? That is the skin. Very good. The skin. Next one, the superficial fascia. Superficial fascia. Skin and the superficial fascia. Then the deep fascia. Deep fascia. Skin, superficial fascia, and the deep fascia forms the roof of the femoral triangle. And superficial fascia, whenever you tell the word superficial fascia, it is complicated. You have to know which are the structures in the superficial fascia. First structure will be superficial lymph nodes. Earlier we studied superficial fascia has superficial lymph nodes. Second structure will be superficial femoral artery. Third structure will be superficial femoral vein. Fourth structure will be, this side we have a ligament, we have a nerve known as ilioinguinal nerve. Ilioinguinal nerve. See, the structures are superficial lymph nodes, femoral, superficial femoral artery, superficial femoral vein, ilioinguinal vein, and just in the center we have genitofemoral vein, genitofemoral vein, genitofemoral nerve, genitofemoral. This nerves we studied earlier. Okay, femoral branch of genitofemoral nerve, femoral branch of genitofemoral nerve. Okay, can I just tell you again? The skin, the superficial fascia and deep fascia forms the roof of femoral triangle. That is okay. Now you have to imagine what are the contents of the superficial fascia. Earlier we studied the contents. Just imagine it contains superficial lymph nodes. Easy. Lymph nodes are there. Superficial arteries are there. Okay, good. Superficial veins are there. Very good. Okay. Then some nerves are there. This is in the medial side. So what are the nerves? Here you have the ilioinguinal nerve. Very good. Here you have the genitofemoral nerve. Very good. Clear? Those are the things that you have to remember. Okay. And of course you have the femoral nerve vessels and saphenous nerve. Saphenous vein. If you want to remember only, otherwise just forget that, and you have the saphenous vein. See, that is the roof of femoral triangle. And now you have the floor. What is that floor? The floor, it's not made of granite, or then it's made of granite, or it's made of bone. The floor is made of muscles, and there are 4 muscles that makes up the floor. One is the adductor longus, which we already studied. Then is the pectineus muscle. Very good. Then is the psoas major muscle. Very good. And here sartorius muscle. So these are the 4 muscles that makes the floor. Just I will show you one more diagram, then you can understand it. So just remember, the muscles are adductor longus, pectineus muscle, psoas major muscle, sartorius. In this diagram you will understand it more. Let us draw the diagram and study. That is most important. So let us draw some few cross section, a few diagrams of the thigh region. You have the ASIS, you have the pivot to ASIS, pivot tubercle, right? The sartorius muscle, the adductor longus muscle, sartorius and adductor longus muscle, inguinal ligament. So base is formed by inguinal ligament, medial border is formed by the sartorius muscle, medial border is formed by the adductor longus muscle, lateral border is formed by the sartorius muscle. This is the sartorius, this is the adductor longus muscle. And base is formed by the inguinal ligament. Apex is formed by the meeting point for both the ligaments. Clear? The first thing. Second thing, where we studied the now we have to study the let us draw the triangle again. Let this be our triangle, and let this be the triangle. Now we have to study about the roof of the triangle. The roof is having, first the layer is known as skin, the second layer is known as superficial fascia, third layer is known as deep fascia. Okay, this superficial fascia contains here ilioinguinal nerve, here genitofemoral nerve, here again it has superficial arteries, it has superficial veins, it has superficial lymph nodes. Superficial veins, you have to study about the saphenous vein. There is a large vein in the lower limb in the front of the thigh, that is the saphenous vein. That is all about the roof. Now you have to study the floor. Okay, floor you have to study the muscle. First one, it is the adductor longus muscle. Then you have the sartorius muscle. Here you have the pectineus muscle. Here you have the psoas major muscle. Here you have the psoas major muscle. See, that's how you have to learn about the floor of what you call the femoral triangle. Floor is made up of sartorius muscle, the pectineus muscle, the psoas major muscle, and the what is called the adductor longus muscle. That 4 muscles makes the floor of femoral triangle. Clear? Okay. Now, since it is a triangle, it will have something that is passing through the triangle. For example, this is a triangle. This is inverted shape. So there are structures that passes through the inside. We need to study those contents of the femoral triangle. Now we have to study the contents of the femoral triangle. I will draw you again one more diagram, and let it be our sartorius muscle, let it be our adductor longus muscle, and let it be our inguinal ligament. The first structure that passes through the floor is the femoral artery. The first structure, not from here, the first structure we have to learn is the femoral artery. Okay, the femoral artery. The first structure is the femoral artery. Femoral artery. Okay. Now, before going to the second structure, it starts from the mid-inguinal region. Mid-inguinal point. Mid-inguinal region. The femoral artery arises or travels from the mid-inguinal point to the apex. Mid-inguinal point to the apex. Okay. Now you have the femoral artery. Here, when in the femoral triangle, it gives many branches. Since it is an artery, let me use the red ink. It will have many branches. So it gives up to 6 branches. It gives up to 6 branches. So arise from the mid-inguinal region. Arise from the mid-inguinal region into the apex, and has 6 branches. 3 superficial, 3 deep. So these are the things that you have to remember about the femoral artery. It starts from the mid-inguinal region into the apex. It has 6 branches, which includes 3 superficial and 3 deep branches. Then after femoral artery, you have the femoral vein. Here you have the femoral vein. Okay. I don't have a greening, so bluing I'm not using for femoral vein. So you have the femoral vein. Femoral vein, just medial to femoral artery. Medial to femoral artery, right? In the apex. In the base. In the base. In apex, postromedial. That means here it will arise medially. But when it reaches this part, this will move on like this to become postromedially. So the femoral vein is medial to the femoral artery, and in the base it is medial to the femoral artery. In the apex it is postromedial to the femoral artery. This femoral vein receives supplies from greater saphenous vein. It receives supplies from greater saphenous vein and other veins. Clear? Okay. Then here we have superficial inguinal lymph nodes. So the contents are femoral artery, femoral vein, inguinal lymph nodes. Clear? And finally you will have another content, that is the nerve. Yes, femoral artery, femoral vein, inguinal lymph nodes, and the nerves. What are the nerves that are the contents of the femoral triangle? The first nerve is femoral nerve. So femoral nerve is the first nerve. It is lateral to the femoral artery. Here you have the femoral nerve. It is lateral to the femoral artery. So the first nerve is femoral nerve. The next one, it is nerve to pectineus muscle. We know that there is a pectineus muscle. So nerve to pectineus muscle. So the nerve to pectineus muscle. Okay. And then central region we have another nerve. That is the femoral branch of genitofemoral nerve. Yes, femoral branch. Okay, femoral branch of genitofemoral nerve. And lateral cutaneous nerve. Finally, lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. And finally, lateral cutaneous nerve of the thigh. So these are the nerves that are seen in the Which one? In the contents of a femoral triangle. That is a femoral nerve, nerve to pectineus muscle, femoral branch of genitofemoral nerve, and lateral cutaneous nerve of the thigh. Okay, that's all about the femoral triangle. Okay, just let us summarize. This is a very important question. You should always remember that. What is femoral triangle? It is a triangular depression. Front of the thigh, upper 1/3 of the thigh. Okay, triangle. It is a triangle. It is inverted shape. It has a base formed by inguinal ligament. Medial border by the adductor longus. Lateral border by the sartorius. Apex by the meeting point of medial and lateral border. Now you have the roof made up of skin, superficial fascia, and deep fascia. Superficial fascia has few nerves. You have to study its nerves. Okay. Then you have the floor. It is made up of only the muscles. That is adductor longus, the pectineus, psoas major, and the sartorius. That 4 muscles makes up the floor. Now you have to study about the contents. Simple. It is very, very simple. You have to just remember the contents. First one, it is femoral artery. Gives 6 branches. It starts from mid-inguinal region into the apex. Femoral vein, medial to femoral artery at the apex. At the base, and posteromedial at the base, apex. And then femoral, lymph nodes. Okay, deep lymph nodes. Okay, and then last one is the femoral nerves. Some nerves, which includes first one, femoral nerve. Okay, nerve to pectineus, lateral cutaneous nerve of thigh, and genitofemoral nerve. Femoral branch of genitofemoral nerve. So these are the things that are the part of the femoral triangle. Along with that, there is another content which is the part of the femoral triangle. That is, I will mark with a star, that is the femoral sheath. So the contents are femoral nerve, femoral artery, femoral vein, lymph node, and most important content is femoral sheath. That is what we have to study later. Again, it is a 3 marks question, or it is an important question. That is the femoral sheath. That is another content of the femoral triangle. Even if you forget to write the femoral, one of the nerve of the femoral nerve, don't forget to write femoral sheath. Okay. Now we are going to study the next concept, that is the femoral sheath. What is femoral sheath? We were discussing about the femoral triangle, right? Femoral triangle. Okay, and when we draw the femoral triangle like this, this is the femoral triangle. This is the adductor longus muscle. This is the sartorius muscle. This is its base. And I just made a small mistake. I just forgot to mention one thing. That here is the adductor longus muscle. Here you have. Then you have the pectineus muscle. Then you have the psoas major muscle. And then you have here the iliacus muscle. That is the iliacus muscle. This is the psoas major muscle. This is the pectineus muscle. This is the adductor longus muscle. So this 4 forms the floor, not the sartorius. That is the adductor longus, pectineus muscle, psoas major muscle, and iliacus. Earlier I mentioned that in floor that is the sartorius, but it is not sartorius. Just kindly excuse that. It is the iliacus muscle. So it is the iliacus muscle that forms the floor. Only one name that you have to just recollect it. That is, instead of sartorius, the floor is formed with iliacus muscle. Okay, forget that. Now about the femoral sheath. What is femoral sheath? It is a sheath. It is a sleeve of. It is a conical. It is a conical sleeve of fascia that covers 3 to 4 centimeter of femoral vessels. So simple it is. It is a conical shaped sleeve or conical shaped covering of the fascia that covers the 3 to 4 centimeter of femoral vessels. So what are the femoral vessels? We studied here itself. Femoral vein, here you have the femoral artery. So this is a conical shaped covering of the fascia that covers the 3 to 4 centimeter of the femoral artery or femoral and vein, that is the femoral vessels. So nothing, here you have the femoral canal. When you remove these muscles or when you just forget these muscles, you have here the femoral artery is there and joining this with the line. Here you have the femoral vein. So there is a sheath of fascia that covers the structure like this. It is conical and this structure is known as the femoral sheath. That structure is known as the femoral sheath. Okay, it is a conical sheath. Here you have femoral artery, here you have femoral vein, and it is a conical shaped covering of the fascia that covers the femoral artery and the femoral vein or femoral vessels. So this is it. Clear? That's all about that. Then how it is formed? So you know that this is a femoral triangle and there it cannot form like that on and sudden. So this is actually the continuation of the abdominal fascia. In abdomen we have fascia. Also this is a continuation of the abdominal fascia and that forms the femoral triangle. So femoral sheath. So femoral sheath is formed by continuation of 2 abdominal fascias. So fascia is a covering, always remember that fascia is a covering layer. So fascia is always a covering layer and 2 abdominal fascia's continuation is this femoral sheath. What are those, which are those abdominal fascia? The first one is fascia transversalis. Second one it is fascia iliacus. Okay, remember the fascial sheath or the femoral sheath is a continuation of 2 abdominal fascias. The first one it is fascia transversalis. You know that in the abdomen you have the transverse abdominal muscles in the anterior abdominal wall. So in this is the continuation of anterior abdominal wall fascia. That is the fascia transversalis. So fascia transversalis anteriorly. And posteriorly it is the continuation of fascia iliacus. So you studied the muscle iliacus here. So it is a muscle that the fascia that covers that muscle. So those 2 fascia, you have your stomach over here like this. Those 2 fascia comes downwards and like this. Those one another fascia comes here and here you have the arteries passing. So that is the femoral sheath. So femoral sheath is a sleeve or conical shaped sleeve of the fascia that covers 3 to 4 centimeter of the femoral vessels, which is femoral artery and femoral vein. Where it is originating, on a sudden a fascia cannot come. It is originating from the abdomen. Where? From the abdomen. That is from the fascia transversalis of the abdomen and fascia iliacus of the abdomen. Okay, and now you have to study some more peculiarity of the femoral sheath. Peculiarities. First one it is conical in shape. Correct? It is conical. I showed you it is conical in shape. This is how it is. This is how it is. This is how it is. Okay, this is how it is. And here you have the artery and here you have the vein. Okay, so it is conical in shape. It is asymmetrical. It is asymmetrical. It is conical in shape. It is asymmetrical. You know there is no symmetry in system. The lateral border, which is this lateral border? This is the lateral border. Is vertical. It is a straight line. It is vertical. The medial border is oblique. Oblique and runs inferiorly, runs inferiorly. Okay, the medial border is oblique shape. The medial border is oblique shape and it runs inferiorly. So these are the peculiarities of the femoral sheath. The first one, it is conical in shape. It is asymmetrical in shape. It is having a lateral border which is almost vertical and its medial border is almost oblique, and it covers 3 to 4 centimeter of the femoral vessels. Femoral vessels. It covers 3 to 4 centimeter of the femoral vessel. So these are the peculiarities of femoral sheath. Clear? Clear? Okay. And finally, there is something more you have to study about the femoral sheath. The femoral sheath is divided into 3 regions or 3 septa. Okay, the femoral region is divided into 3 parts. The lateral compartment or arterial compartment. This is the lateral compartment. This is the venous compartment, and this is the medial compartment or lymphatic compartment. So there are 3 regions for the femoral sheath. That is the lateral compartment, it is known as the arterial compartment. Here you have the femoral artery. Okay? Then you have a venous compartment where you have a femoral vein. Then you have a small compartment which is the smallest. When I draw, this becomes the largest one, but it is the smallest, and that is containing the lymphatics. That is containing the lymphatics over here. So the femoral sheath is divided into 3 compartments: the lateral compartment or the arterial compartment, the venous compartment which contains femoral vein, and the lymphatic compartment. And that lymphatic compartment is known as femoral canal. That is the next question that you have to study. That is the femoral canal. Okay, so it is divided into 3 parts. First one, it is the lateral compartment or arterial compartment, then the venous compartment, and then the lymphatic or compartment or femoral canal. Femoral canal. Don't forget, I am writing it because it is the next important thing. That is the femoral canal. It is the smallest. Now to study, we don't have to study the largest one, but we have to study the smallest one again. You have to discuss in detail about that. So that is the femoral canal. So don't get complicated. You have a femoral triangle. Then very good, you have studied about the femoral triangle. And in the femoral triangle there is a peculiar structure. That is a sheath, a fascial covering. One fascia sheath is forming a different shape or different. It is having a different orientation, and that is known as the femoral sheath. It is actually the continuation of the transverse fascialis, fascia transversalis, and fascia iliacus of the abdomen, and it covers 3/4 of the vessels. It is asymmetrical, it is conical in shape. It has a vertical border laterally and an oblique medial border. Now it is divided into 3 compartments by the septa. Okay, that is the lateral compartment or the arterial compartment, the venous compartment, and the lymphatic compartment, and that lymphatic compartment is known as the femoral canal. Femoral canal. Okay, and that compartment is known as the femoral canal. So next our discussion is on femoral canal. Everything is important here. Next discussion is femoral canal. Take a minute of break, just think and memorize, then we will study the femoral canal. We were discussing about the femoral canal. Okay, now once again the old diagram of the femoral triangle. Let it be our triangle, and in this we have here the femoral vein, and here let this be the femoral artery, and let this be the femoral nerve vein, and there is a fascia that is covering the upper 3/4 of this thing, upper 3/4 of this, and this is known as the femoral sheath. Now what is femoral fascia, femoral canal? What is femoral canal? It is the medial compartment or lymphatic compartment of femoral sheath. So this compartment is known as the femoral canal. I have drawn it a bit larger for you to understand. So it is the medial compartment of femoral sheath. It is a medial compartment or a femoral sheath, or it is a lymphatic compartment of the femoral sheath. That is known as femoral canal. Now it is a medial compartment, okay, medial compartment of femoral sheath. It contains lymphatics. Okay. Now it is conical in shape. You can see that this is conical in shape. Exactly speaking, this is conical in shape. Here you have this one, which is femoral sheath. This total thing is femoral sheath. Inside this conical part is known as femoral canal. This femoral sheath can be better told that it is a funnel shape. It is having funnel shape. And this can be better told that it is having a conical shape. It is having conical shape. Wide at upper part and lower towards the bottom is smaller. It is having a wider upper end, or we can tell it as a base of the femoral triangle. Okay, it's a base, and narrow lower end, wide upper end and narrow lower end. So that is a peculiarity. This wide upper end is 1.5 centimeter. This total length is also 1.5 centimeter. So 1.5 centimeter wide and 1.5 centimeter long. 1.5 centimeter wide and 1.5 centimeter long. And another peculiarity, this portion is like a shape of a ring, and that is known as the femoral ring. Its base is known as femoral ring. Don't forget, its base or upper end is known as femoral ring. So once again, it is the medial compartment of the femoral sheath is known as femoral canal. Okay, and it is having the lymphatic. So it is known as lymphatic compartment. It is conical in shape, wider in the base or in the upper end, and its wide is 1.5 centimeter. Total length is also 1.5 centimeter. Okay, and narrow to the lower part, and it is also having the upper end, which is known as the ring-shaped femoral ring. Femoral ring. So the upper end of the femoral canal is ring-shaped, and that is known as the femoral ring. The upper end of the femoral canal is ring-shaped and is known as femoral ring. Okay, clear? So femoral ring. Now there is something that you have to do. You have to study the boundary of this ring. It is important. It is the boundary of the ring. Boundary. I will tell you an easy manner to study. Okay. It is having an anterior boundary. It is having a posterior boundary, lateral and medial. Anteriorly you have the ligament. Always don't forget you have that ligament. That is the inguinal ligament. Okay. Posterior, P stands for one muscle. In the floor we studied a muscle with the P. That muscle is, can anybody tell? The pectineus muscle. That muscle is the pectineus muscle. So posteriorly by the pectineus muscle and its fascia. Okay, and its fascia. Then laterally there is a ligament known as lacunar ligament. So L for L. You may think it is lateral, but here it is medially. Here remember the difference. Medially by the lacunar ligament. So just see the boundaries. Anteriorly always by the inguinal ligament. Posteriorly by the P for P 3, 4P, that is for the pectineus muscle. And medially by the lacunar ligament. Don't think lacunar ligament L, so it is laterally. No, it is here, it is medially. Laterally, which is a femoral vein. So septa cover different septa separating from femoral vein. Laterally by the septa that separates from femoral vein. Okay. Laterally by the septa that separates from femoral vein. Let us once again tell the boundary in an easy manner. Anteriorly by the inguinal ligament, posteriorly P, that is a pectineus muscle, medially, laterally not by the lacunar ligament, therefore medially by the lacunar ligament, and laterally by the septa separating laterally by the septa separating from femoral vein. Laterally by the septa separating from femoral vein. Now, this femoral triangle and femoral sheath and the femoral canal is covered by an upper layer. Is closed by an upper layer, and that layer is known as femoral. That layer is known as femoral sheath. That layer is known as the femoral sheath. Okay. And that layer is again covered by a peritoneal layer, and that layer is known as the femoral fossa. So no need to get complicated. Okay, this femoral sheath is again covered by a peritoneum, and peritoneum has a depression that is known as the femoral fossa, and that peritoneum has a different depression that is known as the femoral fossa. So you have to remember there is a femoral fossa in the femoral vein, that is a depression of the peritoneum. Clear? So we studied the femoral triangle, femoral sheath and the femoral canal. Okay. Now we studied that this compartment is known as the lymphatic compartment, because it has a lymph, and that lymph can be known as cloquet. That lymph nodes has two names, cloquet or Rosenmuller lymph nodes. So the lymph nodes seen here drains, and that lymph nodes are known as cloquet or Rosenmuller. So cloquet or Rosenmuller, not a closet. Cloquet or Rosenmuller lymph nodes. This drains from gland penis. You have studied from the reproductive system. Gland penis in males and clitoris in females. So this drains from lymph from the gland penis in females and clitoris in females. So the lymph nodes present in the femoral canal is known as cloquet or Rosenmuller lymph nodes. Clear? So once again, let us summarize what is the femoral canal. It is a medial compartment or lymphatic compartment of the femoral sheath. It is conical in shape, wide at the upper part, narrow at the lower part. Wide upper part is 1.5 cm, total length is 1.5 cm. Anteriorly, it is bounded by the inguinal ligament. Posteriorly, it is bounded by the pectineus muscle. Laterally, by the septa separating from femoral vein. Medially, by the lacunar ligament. It is having it is closed in the upper part, that is known as femoral sheath, and topmost of it has a depression that is known as the femoral fossa. Clear? And it has lymph nodes. Those lymph nodes names are cloquet or Rosenmuller lymph node. That's all about the femoral triangle, femoral sheath, and finally femoral canal. Any of this can be asked. This is important. Either it can be asked femoral canal triangle, then you have to write about all this, or it can be asked femoral sheath for 3 marks, or it can be asked for femoral canal. Always you have to study the diagram. Now, to wind up the clinical aspects. Okay. First one is the femoral hernia. You know what is hernia? You have heard that your grandfather or somebody on the old age or after 60s has hernia, and they did surgery for the hernia, etc. Something like that. So hernia is an indentation or sac-like cavity. The abdominal contents protrude down, okay, through weak portions in the body. So you know that the intestine and its contents are just lying there, and the peritoneum is covering there, and there are some weak spots through which the contents can pass down. That is known as hernia in simple manner. Okay, and it has a sac-like appearance. It has this would be its appearance. This would be its appearance. One neck will be there, and a sac will be there. Neck and sac. Now you need to study all this. That's femoral hernia. Femoral hernia. See, femoral canal. You know, it is a conical shaped structure. It's a conical shaped structure. Upper part is just covered by this one, and it is only having the lymphatics. So it is a weak portion. So femoral canal is always a weak portion through which the abdominal contents may protrude downwards and results in the formation of femoral hernia. So first clinical anatomy is clinical aspect is femoral hernia. The femoral canal is a weak spot through which the abdominal contents can pass down, protrude down, and can result in femoral hernia. Okay. The second one is femoral nerve injury. Femoral nerve injury. So if injury happens to the femoral nerve, there will be the sensation loss in your thigh region. Okay, sensation loss in anterior of thigh. Sensation loss in anterior of thigh. Okay, sensation loss in leg, front of leg, and medial border of foot, up to big toe. I think rather than studying, you can just draw the diagram. Okay, so this let this be a person. You have the patella over here, you have the leg over here, and we say you have the feet over here. Okay, so if there is an injury to the femoral nerve, there will be sensation loss here. There will be sensation loss in this area. This diagram is shown better in the Chaurus surface. Okay, refer that. This is the anterior of the thigh, this is the front of the leg, and in the medial border of the foot, up to the big toe. So, up to the big toe, there will be sensation loss. So, that is the second clinical aspect. First one is femoral hernia. Hernia is an indentation of through which abdominal content can protrude. Femoral canal is a weak spot, and through the femoral canal, hernia can happen. So, that is the first one. The second one is femoral nerve injury, which is what is it? It is due to the injury to the femoral nerve. There will be sensation loss in anterior thigh. There will be sensation loss in the front of the leg and medial border of the feet up to the big toe. And last one it is injury to the lateral cutaneous nerve. Lateral cutaneous nerve. So if lateral cutaneous nerve is entrapped or compressed, okay, it can result in pain in the lateral side of the thigh, lateral side pain, and that is known as meralgia paresthetica. Meralgia paresthetica. Okay, that is known as meralgia paresthetica. That is due to this is why I told you how to study the nerves, name of the nerve. At that time you may think that, oh, this is heavy, but here it is important. And lateral cutaneous nerve injury can result in entrapment or compressed state of the lateral cutaneous nerve can result in lateral side pain and loss of sensation. And this is known as meralgia. So, if femoral nerve is injured, the anterior part is having sensory loss. If lateral cutaneous nerve is injured, only the lateral border will have pain and severe pain and sensory loss. So, you can understand that that is the problem due to lateral cutaneous nerve, and that condition is known as meralgia paresthetica. And this can occur in cases when you wear some tight dresses for a long time. That can occur. That may be one of the reasons, and this is quite common. Meralgia paresthetica. Femoral hernia is also seen usually, and nerve to the injury to the femoral nerve can produce anterior thigh pain, etc. So once again, if you summarize, we saw the anterior compartment of the the anterior of the thigh or the front of the thigh. You have the skin, you have the superficial fascia, you have the deep fascia. Skin, you have nothing is not to worry. In superficial fascia, you have some what you call cutaneous nerves and cutaneous vessels. You have to study that names. Then the femoral triangle we discussed. What is femoral triangle? It's a triangle. Since it's inverted triangle, it has a base apex, it has a lateral medial border. Then you have to study its roof and its base. Then you have to study the contents. That's all. Femoral triangle is solved. Then one of the structures in the femoral triangle, that is the femoral sheath. Okay, it is a covering of the vessels in the femoral triangle, conical funnel shaped. And what are the relationship of it? You have to just study that. Okay, and what are the three divisions: arterial compartment, lateral or arterial compartment, intermediate or venous compartment, and medial or lymphatic compartment. And that lymphatic compartment is known as the femoral canal. Then you have to study the femoral canal. What is femoral canal? Okay. Then what is the importance of femoral ring in that? Then what lymph vessels it drains? Blockade and Rosenmuller. Then finally the clinical anatomy. Okay. With that we will wind up the one of the smallest portion in the front of the thigh. Not smallest actually. Okay. Then you have the anterior compartment, the muscles in the front of the thigh, which we will discuss in the next class. So stay tuned. And this is from the reference is from the Chowdhury textbook. You have to refer that and make a note and study. That would be good for you. Thank you so much and have a good day. Bye.